Good afternoon. Thank you for joining us. I'm Al McFarland, editor of Inside News and host of Conversations with Al McFarland. Thank you for being here. We've been doing, and we're glad to bring you today's program. It's called Heart to Heart Conversations, joined by our partners at Minneapolis Heart Institute Foundation. Today's conversation is the third in a series of 5 conversations we're using this time to talk about the work we've done in the health disparities reduction space and to talk about how we are working together to advance health equity. Our guest today is Loralean Jordan. In January of 2006, Loralean survived an aortic aneurysm that had ruptured the night before her surgery. She says she's blessed to be alive. Heart disease runs rampant in her family, and since surviving her own heart issues, Loralean has made it her life's mission to tell her story in hope of helping others become their own health advocate. Leading the discussion today, the conversations today, are Dr. Courtney Jordan-Baechler and Dr.Mosi Bennett, who are both cardiologists and researchers at Minneapolis Heart Institution Foundation. Let me begin by welcoming you, Loralean, and start with you telling the story. What happened, 15 years ago?
15 years ago.
Tell the story.
All right. Well, thank you so much, Mr. McFarland, and thank you guys for having me here today. Um, it's interesting because I went misdiagnosed for an entire year. So my journey started in September 2005, where I was actually at work and I was on the treadmill and I felt different, like something was wrong. And so I made an appointment the next day to go see my doctor. And I went and talked to her, and she's just like, "You have a heart murmur." And I said, "Yeah." And she said, Do you know what's causing it?" And I'm like, "No clue." And she's like, "Oh, okay." And so she sent me over to do a stress test. And then she sent me somewhere else to do another test. And with the stress test, everything kept coming back as normal. But there were times throughout that next year that I just did not feel well. I know in January of 2005, I took a ride in the ambulance from the clinic to United Health Group, to United Hospital because I had 2 different blood pressures in each arm, and I have symptoms of shortness of breath, but I wasn't having a heart attack. My EKG came back fine. Like I said, it's been a whole year of them running tests trying to figure out what was going on. The doctor some said, "Oh, you were stressed." Some said it was psychological. So they had me do another stress test. Then they had me talk to a psychiatrist. I mean, it was just round and around of different kind of misdiagnosis, but trying to figure out what exactly was going on. Um, in November of 2005, my doctor said, "Okay, humor me. I need you to do one more test." I'm trying. So her purpose was trying to figure out what was causing the heart murmur because every time I came into her office, it would change. There's some days where she could barely hear it, and then some days that she would just hold the stethoscope just above my skin and she could hear it plain.
Hmm.
So it was changing, and she's like, "That shouldn't change like that." So she's like, "Humor me, do this one last test." And I was just like, "I am tired of being poked and prodded. I don't want another test." And she's like, "Just humor me. Just do this last test." And it was a TEE, transesophageal echocardiogram. So they went down my throat to look at my heart. And it was even with that test, the cardiologist at first was like, "Oh, you have a cyst on your heart about the size of a quarter shaped like a strawberry." And I was like, "Okay." And he's like, "But I'm still going to take this over to the surgeon to figure out exactly what this is." And so he sent me, the test happened in November. He sent me home, continue to exercise, do whatever you need to do. And then he called me the day after Thanksgiving and he said, "I figured it out." Well, he actually said, "The surgeon and I figured it out. We need you to come back in. I'm going to have you talk to the surgeon and we're going to be able to fix this." And I'm like, "Okay." And so I went back in, and that's when the surgeon was like, "What you have is a sinus valsalva aortic aneurysm. And I said, huh? So he drew a picture of my heart and showed me where it was. He's like, you have an aneurysm. It's right above your valve, the sinus valve. And we're going to have to do open heart surgery to repair it. And I'm like, okay, you mean like you go in and it's like the balloon thing or what? He's like, no, we have to go in, crack you open, put you on a bypass machine, take your heart out and repair it. And I was like, okay. So we didn't schedule time for surgery at that point in time. They sent me home. A couple of days later, I was at work and I wasn't feeling well at all. And I called my mom, who lived long distance, and she's like, "Well, baby, there's nothing I can do for you. You need to, you know, either get to the hospital or call a friend." So I called a friend and said, "Hey, I'm at work. I'm not feeling well. Can you come pick me up?" And she's like, okay. I said, just take me to United. She's like, okay. So she was on her way. My coworker came in my office and she's like, your lips are blue. Your color is gone. Something is wrong. And I'm like, I'm fine. I got a friend that's coming to pick me up. I'm just not feeling well. And she's like, let me help you pack up your stuff. So she helped me pack up my stuff. She helped me get, we walked to the elevator, got down to the first floor. The receptionist there was like, I'm calling 911. She's like, you don't look good. Your color's off. And I'm like, well, a friend of mine's coming up. She just pulled up. She's going to take me to the hospital. Friend pulled up. She took me to the hospital. They got me there in the ER and they started running tests and my color came back. My heart stopped racing because that was one of the other triggers. My heart would start racing and they couldn't get it to stop. And so they were able to get it to stop and called a couple other friends and people came down to check on me. My pastor, my priest came down. Um, and they were getting ready to send me home that night. And the surgeon said, well, if she's there, let's just keep her because we still need to run a whole bunch of tests to figure out what exactly is going on. They still need to do a aortogram and an angiogram just to see the lay of my heart and some other tests to make sure there's nothing else going on. He's like, we might as well keep her. So they kept me and they started running the test. And the night before my surgery, I just wasn't feeling well. And all the bells and whistles kept going off all night long. They allowed my parents to stay in the room. My parents drove up from Central Illinois to be with me. They allowed them to stay in the room. And I just remember about 3 o'clock, my mom climbed into bed with me. She's like, just need to calm down. And I'm like, but mom, something's not right. Something's wrong. Something is wrong. And she's like, well, you're just nervous. And I'm like, mom, something's not right. And so they came in about 4:30 to prep me for a surgery and the whole shower thing and everything else. And they went off to surgery. And I remember distinctly there was a nurse that was with me and I started crying and she's like, why are you crying? I told her, I said, I don't want to die. I said, something's not right. I don't want to die. And she's like, you won't, you're here, you're right in the right place. We'll figure this out. So after the surgery, the doctor came and talked to my parents and he asked my mom, had she not been feeling well? Mom's like, yeah, she kept complaining all night long that she wasn't feeling well. He's like, she was right. It had ruptured and she was starting to go into congestive heart failure. He said, we got in there in the nick of time. And the reason why I tell everybody my story is one, it's the nick of time. Two, that for a whole year I went misdiagnosed. If I had just not continued to advocate for my own health, I would not be here. And that's the true result is the fact that you have to be what I learned is I have to be my own heart, my own advocate. And oftentimes I remember, different doctors are like, it's psychological. We can't figure out anything. Everything keeps coming back normal. I'm like, but something is wrong. Something. I mean, I shouldn't be feeling this way. I mean, there's no way I should be on an elliptical machine and my heart rate is 174. That is not normal. There's something wrong. They're like, well, you're overweight. I'm like, yeah, but there's still something else going on beyond that because I should not be feeling this way. And so they went in, they fixed it. he told my parents, and he told me, he's like, you should be good for about another 100 years. We fixed it. So they actually took a piece of my heart tissue, and they actually clamped where the aneurysm was. And then they put my piece of heart tissue over it as a patch. And so I've been, had another echocardiogram um, last year, and they could see the patch was still holding and everything's still holding. So it works out fine. What they did find when they went in and they figured out what was causing the heart murmur is there's an extra piece of flap on one of my valves, but it's not blocking the flow of blood. So they just left it alone. Because part of why they, when they went in, they wanted to see what else was going on so they could fix it while they're in there. Now, they would not give me the liposuction that I wanted. But, they're like, okay, we're going to fix your heart. And I'm like, okay, that's fine.
What a story. What a story. Wow. Well, so glad that you paid attention to yourself and discovered your voice in this process, and so glad you've discovered the power of the story that you're telling. I am just totally blown away by what you are saying right now, and I'm grateful. I'm thankful. So let's turn it to the doctors. You guys, Courtney and Mosi, take it from here and let's have a conversation.
Great. Thank you so much for sharing your story.
I need volume from you, Courtney.
Oh no. Okay. Rosie, go ahead. Can you hear me?
Loralean, thank you so much for sharing that story. And I understand it's 15 years ago, so that's what a milestone, what an anniversary, and it's what a powerful story. The In a way, it really speaks to the fact that you were your best advocate at that time, um, making sure that the healthcare team paid attention to your concerns. It sounds like you had to push for that.
Mm-hmm.
Um, and there's a couple things that jump out. There, it really was in the nick of time. There were certain flags and things that happened over the course of those months that 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 brought things to attention. But you were in the right place. We know that a ruptured aortic aneurysm is a life-threatening emergency. And the fact of the matter is that most people that happens to do not survive. And certainly if it happens out of the hospital or it's a matter of minutes. So it just makes your story even more powerful and touching. Just so we understand, the aorta, as you learned, is the main blood vessel. It's the main tube that takes blood from the heart throughout your body. It's a large blood vessel. It's around 3, maybe 4 centimeters normally in diameter. And an aneurysm is just an enlargement of that tube. So this enlarging can happen anywhere along that blood vessel, the aorta, and as it gets bigger over time, the risk of it rupturing increases. So you can imagine blowing up a balloon, and the risk of it popping increases as the balloon gets stretched and larger. So it's as you can understand, it's a really in the nick of time. It was managed. So I'm very thankful that of course that things worked out that way. Going back to the beginning of your story, before this came to your attention, before it came to anyone's attention, did you notice, or did you have, or were you aware of any problems with your heart when you were a child or earlier on that did come to medical attention, or that anyone spoke to you about?
The only other thing that I knew that I had was the heart murmur. And that's something that I've had all my life, but they've never really followed up to see what was causing it. It was something that I was born with. And in fact, it's interesting because when the surgeon told me about the aortic aneurysm, he felt there was something that I was born with, just a weak spot in my aorta that just, progressed over time. Because back in 2005, that whole year, there were different points in times where I just didn't feel well. And what they found when they did the aortogram and angiogram was that it was leaking. So it was starting to leak. And at the times that I wasn't feeling well, it was somewhat mixing oxygenated and non-oxygenated blood. And those were the times where I'm having those quote unquote episodes. So that was the only sign was the heart murmur. That's what it was like, searching for the heart murmur. What was causing that is how they found the aneurysm.
Are you guys able to hear me now? Can you hear me? No? Yes? Okay, good. All right, good. This is happening. Well, again, thank you so much. You have shared so much information.
We're not hearing you very well, Courtney.
Oh, goodness. All right. Go ahead, Mosi. I'll try to troubleshoot here.
All right. Well, I'm sure Courtney and I are thinking along the same lines here in terms of the various aspects of your story. What about Loralean? Tell me about your blood pressure before all this happened, in the months that it was being discovered, and afterwards. Any concerns about high blood pressure or hypertension or your blood pressure?
There was some one of the things that they did during that one times where it was elevated. And so they did put me on that during that first year, during the year of searching.
Okay, so I didn't hear some of the audio there, but the reason I ask is that elevated blood pressure is probably the most important, or one of the most important risk factors for an aneurysm. Controlling you want to lower the pressure so that the aorta does not continue to enlarge. So most people who have aneurysms, of course, they're not discovered, and and hypertension is very common. So even after a repair of an aneurysm, a surgical repair, it'd be important to control blood pressure. And we know that in our community, hypertension is extremely common, and it can manifest, it can show itself in so many different ways. The aneurysm being only one, and the others being stroke, kidney disease, heart attack. So I just wanted to highlight what that should be a focus of your care now, and may have been a concern leading up to the event.
I have a question, doctor, and that is, you mentioned that you didn't feel well. So what does that mean? Is it headaches, or can you describe what not feeling well meant? And then, doctor, for you, a question. She had said, Loralean had said, 2 different blood pressures in 2 different arms. What does that mean? Anything? I've never heard that before. How do you react to that, or what does it mean? So first, Loralean, when we say feeling
the
bad,
not feeling
what
well would be so the feeling bad for me. Can you hear me okay? Or am I frozen?
No, you're okay. Okay.
Okay. Okay, perfect. The feeling bad for me was, every once in a while, like a little shortness of breath. And in fact, one time I was actually getting ready to go walk, and I was on a walk, and I just, I'm like, oh, I can't catch my breath. This is not normal. So it's like a little shortness of breath, just to the point that, there's times where you don't feel well. I mean, it's hard to describe that you just really don't feel well. You had that premonition, something's not right, that you're not able to do what you normally would do. And for me, it was like, I'm a big person that likes to walk. I've done a half marathon, and not being able to catch my breath on a normal walk when I'm only about maybe 2 blocks from home, something's not right.
All right, how about now? Are you able to hear me? Yay, I get to temporarily be my wonderful colleague Gretchen, but I'm glad to be able to listen in. And so what I was what I was curious to chat a little bit more about is you emphasize that you were misdiagnosed, and there's actually a documentary that was made specifically called Misdiagnosed and talking about women's heart disease. And I just want to congratulate you in advocating for yourself and sort of um, give everyone else that permission when you have that gut feeling like you did that something was off. It usually is. And it takes a lot of courage to do what you did. And unfortunately, we see these disparities in women, and then we see the strongest disparities in Brown and Black women. You know, so whatever, I'm curious what your advice is for folks to encourage them to have that strong advocacy that you were courageous enough to have. Any advice
Can
for
you hear me
our
okay?
listeners? Yeah.
Okay. Yeah, I would say definitely have to be your own health advocate. If you're not getting the answers that you think you should have, or if you're not getting the answers that you need, continue to ask questions and continue to fight for getting those answers. Like I said, it was my last test. And in fact, I didn't want to do the test when she told me you had to put me under and go down on my throat. I was like, mm-mm. So it was that last test that actually found out what was going on. And so it's listening to your doctors, but making sure that they listen to you. Because in that process over that year, I had changed primary care physicians because I felt they weren't listening to me, that they were blowing me off. So finding that primary care physician that actually listened to me, that didn't say, okay, this is not, this is psychological or whatever. She was the one who listened to me. And then when I went back to her after the surgery, she was kind of like, I was shocked to find out that's what it was. She said, because I did not think that's what the issue was.
Mm-hmm. And sometimes, to what you're saying, this isn't super common. It's not a super common finding that we see, but sometimes that's what it takes, is going back. I always will say to folks, as a doctor, we only know if you come back. We assume otherwise, that it worked and that you're doing okay. And sometimes I think that's not really well explained to patients, to say, if you're not coming back, or if you're not feeling well, please do come back, because medicine is such an art and not always a science, that sometimes those tests that are complicated to schedule and to come back, and all of those things that you went through, unfortunately, can be a part of a complicated health system and health system throughout the country, I guess, that we have. My other question for you is, how has this changed your life now? What is, sometimes after events like this, we feel very like we did it. We fixed you. You're ready to go, go live your life. But as the human on the other side, sometimes it's traumatizing to have been through an experience like that. So what was that journey like for you?
It took me about a year and a half to realize that I was going to live. So you have that thought of like near death experience, that I was on a bypass machine for, a certain amount of time. That machine was bringing oxygen to my blood. Um, and then oxygen to the rest of my body. And so it's kind of interesting, that piece. But once I realized that I was going to live, it was just a point of, I had to deal with the fact that I survived. Because the surgeon told me that most of the time he sees what I have in cadavers when they're doing an autopsy after someone's passed. That is very rarely that you see that on a live person. And he was also like, get a second opinion, which I did. I got a second opinion with my dad's cardiologist, and he was just like, he was one who said, I very rarely, he said, I've never seen this on a live person. And in fact, I wasn't supposed to have my surgery in Minnesota. I was going to go home to Illinois and have him do it, but I never made it. And he's just like, I'm kind of glad, because it's like, if you would have gotten on a plane, you would not have made it. So it's like all these little steps. And so it's like, for me, it's like, okay, I was meant to have it here. I was meant to have the surgeon that I was supposed to have. I was meant to survive that. And then, okay, so what next, God? What next? What am I supposed to do? And I just felt that, one of the nurses at my physician's office was the first one who say, hey, I think you should tell your story to people. And I'm like, really? She's like, yes. And I'm like, okay. And so she's the one who got me involved with the American Heart Association and other groups, and telling in within the community and telling my story. And I can say I have a couple of friends that have had similar incidences, which, some of what I've told them made them go to a cardiologist, and they found out they had certain heart issues now, but they would not have known or would not have thought to do that because I was so young. I was only 30, 35, 36 when this all happened.
Go ahead, Mosi.
Yeah, so Al, your earlier question, the second part about, and Loralean, the issue of having blood pressure, which was different in your different each arm, is a sign that there is a likely a problem with your aorta. So what that, as the aorta supplies blood, has branches that supply blood to all of our organs, arms, legs, and if there is a blockage, some disruption in flow of this blood, a tear, a leak, it may present as a different in pressure. There might be low pressure on one side, high pressure on the other side, because of where different branches come off of this main blood vessel. So while it can't diagnose the problem with the aorta, it is certainly a concerning sign. And anytime as physicians, we pick up a difference in blood pressure from left to right arm, or even arms and legs, it will prompt us to look a little bit further to see if we can explain that. And one of the most concerning findings is a blockage in the aorta, or a tear in the aorta. So everything, Loralean, that you've described fits this very concerning picture. And again, you were in a way, you were in the right place to get through this.
We have a couple questions. One of the questions that we got on Facebook Live is for both Mosi and I, is there a genetic component to your condition? And Mosi, you can correct me here. Sometimes when we can see different types of vessels that can be hereditary, in the sense that sometimes people can be born with a vessel that is more likely to get that type of dilation or aneurysm that you experienced. And then sometimes, likewise, we can also see differences in the valves that can be involved in the aortic valve. Like you mentioned, you were, as far as you know, kind of born with a murmur, or you've had a murmur for some time that way. So it's never a bad idea to have family members looked at that way to ensure that there wasn't anything hereditary. But this isn't something that we see consistently hereditary that way. Anything you would add, Mosi, to that?
No, you I think you covered it very well. There's certain types of issues with the aorta that can run in families, and going back to the risk factors. Really, the one that we understand the most is high blood pressure. So I think the things that you can do, that we all can do, are just know our numbers, know what our blood pressure is. If it's elevated, the work on the many things we can do to control it. And as Courtney mentioned, there are certain conditions, either genetic, that can affect the actual structure of the aorta and can run in families, or the type of valve. that can also be associated with problems with the aorta.
And then there was also a question for you, Loralean, from our listeners. What are some of the ways that you're caring for your health now, specifically lifestyle-wise? What are you perhaps doing differently now?
I'm trying to eat more healthy. And the other big piece is I am a big walker, and I actually just until COVID hit. Prior to COVID, I actually taught two classes. I was a Zumba instructor and I taught a spin class at the YW. So I got really involved in exercise and activities and challenging myself. I have walked a half marathon before. I've walked several different 5Ks and 10Ks. So like I said, I'm a big get out there and walk, and just movement, any type of movement, whether it's dance, any type of exercise. Even in the COVID era, I mean, I'm usually dancing around my house, walking around my house. If it's like today, it's snowing, I'll be doing all that. There's all different types of online classes, weightlifting classes. I worked with the trainer before, prior to COVID. So just getting active and then watching what I eat. But also going back to the hereditary, for me, it is heart disease runs in my family. My grandfather had a heart attack at 45. My dad survived several different heart attacks, 2 strokes. He passed away in September, but I mean, heart disease was very prevalent in my family.
And that's such a powerful thing to know your family history that way, and to know what has run in the family, and then hopefully to be able to break that trend, right? We know it turns out that about 15% of your overall risk of developing heart disease is from genetics, and then 85% of it gets to be sort of in our control, with multiple factors that way. But so I think sometimes family history can be helpful to tip us off, and then really narrow in on how we best change this going forward. And it sounds like you're doing the wonderful work from that perspective. We just to add to what you're saying, we when we talk about heart healthy foods, we're usually talking about a Mediterranean diet. So really emphasizing fruits and vegetables, legumes and lentils and nuts, and some of the fish and poultry things like that are more consistent with the Mediterranean diet. I'm curious that way that often we don't live in the Mediterranean, we live in Minnesota. So what does that mean as you talk about your healthy nutritional side of things? What does that mean for you in your life? What does a day look like of what you might send to our listeners of how you incorporate that into real life?
More fruit. My thing is I love apples. And so it's like the, especially Honeycrisp and Zestar apples. And so I am a big, once a day, sometimes twice a day, I'll eat my apples. The other piece is I love certain vegetables like broccoli and Brussels sprouts. So I'm a big veggie eater. And there's often times that I'll have like 1 or 2 days that are just vegetarian day. So no meat at all. And it's just all vegetables and fruit and healthy snacks. Like I love the snack on carrots. I'm not a big have to have dip person. If I do have a dip, you can use yogurt, especially Greek yogurt with a little bit of chives and some spices in it. So that's kind of how I eat every once in a while, especially in the holidays. I have a Southern background, so I have to have my Southern food, but in moderation. It's okay.
Let me ask a question, Loralean. Seems like you might look back over your life in stages, right? And maybe you look at your life work now, because you've described what you're doing now as life work, telling the story, motivating other people to pay attention and to figure out ways to be in charge of their own health and life, and be partnering with resources like their physicians. So how do you look back in stages? You described first that year before us having some things that you were concerned about. Then you described that period of crisis. And then you described afterwards. I was curious when Dr. Mosi first said that usually people that experience what you experienced don't survive. That kind of hit me like a ton of bricks, number one.
Mhm.
For him to say that, and I said, I wonder how she feels about that. And then when you responded, you said your doctors told you that they were surprised as well. So my question is, how do you process that? Hearing from your physician and even sort of having what they told you then reaffirmed by Mosi today. How do you handle that? And what does it mean? And you said you went to a point where you decided that you were going to live. I'm curious as to what the before and after of that decision process was. Does that make sense as a question?
It does, and it's truly a process, because I mean the first couple of days after my surgery, I'm just trying to one survive in a hospital, and just realizing that within the first year you have the surgery, they fix you, and then you think, okay, you'll go through the cardiac rehab, but then you'll be back doing whatever you were doing before, like you were doing before, and that's not it. I mean, it takes a while for recovery, and I was never like a very patient person in regards to recovery at all. And just getting processing that whole piece of, okay, this is recovery, and that when they open you up, when they crack open your chest, it impacts everything in your body. And I didn't know that. And so it's like a lot of things, when things would happen, I would call my doctor, and she was the most patient person in the world, because I'm like, I got indigestion now. Is this normal? And she's like, yes, this is normal. You know, she's the one who had told me they crack you open, everything changed. I mean, the fact that I started, part of my rehab was to walk, and so I would go to the community center and walk around the track. And there was a time period where my mother would lap me, and I used to lap her all the time, and now she's lapping me on the track, and it's just like, I'm still recovering. My body has gone through a traumatic experience. I need to allow time for it to heal. But then once you allow that time, you're still in that, why am I the 1% or whatever percent that survived? And then for me, it was my talking with my priest at the time, and faith, that said, he's like, well, you're here for a purpose. You're here for a reason. You survived for a reason. You're the one who has to, you and God have to figure out why that reason is. And so it took me, I mean, I would tell my story bits and pieces, but it took me a long time to really feel that need and feel that energy to say, hey, I'm here for a purpose, and maybe this is my purpose. Telling my story, helping other people out, helping other people become their own health advocate. Maybe that's why I'm here. And it took a while for that to sink in, because you still get over that. I mean, you still have that piece of, there are some days that I think, I'm like, oh my God, I survived that. Why am I here? Okay, this is why I'm here. Okay, so, but still, you still have that question of, wow, I survived that. And so that piece never goes away. And every year when the anniversary comes up, I'm like, wow, I really survived that. But then it also challenges me to be, wow, okay, I need to do better in my food choices. I need to do better in this, because I did survive it.
Okay,
You
thank you.
are definitely a survivor. Very, very impressive. So, and one thing to what you just mentioned that I wanted to emphasize for the listeners is, I think after an event like you went through, or a heart attack, anything that really surprises us, I find in patients that our body is kind of hyper aware of anything in that chest region, arms. And so, to what you're saying, when you came back and we're checking in about heartburn or indigestion, that's normal. And normal in the sense, normal to call your doctor, double check that it isn't your heart. And, to the earlier conversation, I think most doctors really appreciate that. And if you didn't have a doctor that did, probably time to see who else is available. And I think it really helps us kind of start to sort out, okay, this was heartburn. So when I get that exact same symptom, I'm okay, but this is a new one. Maybe need to get this evaluated, because it's always better to be safe. As you know, you've learned in the situation, and I just think it's so important that people know they're never bothering physicians for those things. That's what we're supposed to do. And we're always glad to say, oh, good news, it's heartburn or whatever the case is, but you never need to try to make that decision on your own. There's another there's another question from our listeners. So this person says, given your personal experience and the overall global low awareness about heart disease, what are some ways you think other women could learn about the impacts and importance of focusing on their cardiovascular health?
I would say
Thoughts on that, Laura?
I would say one, research, kind of research what heart health. I know I'm one of the heart health ambassadors for the American Heart Association, and so there's a lot of information that they put out. Talk to your physician, have that conversation with your physician if you feel something's not quite right or you have questions about your heart. Ask your physician, have that conversation. It's the point of educating yourself as much as you can, but know that you're not the doctor, they are. And then and relying on them to provide you with the information as well.
It's this journey in terms of you finding some meaning in this event, and it's really showing some courage to tell your story, and everyone who hears your story is impacted by it, of course, and so you're really affecting change in a positive way, and you're the whole going through such a big surgery. All surgery is big. Of course, yours was very, very big. And I'm not sure that as doctors, we are always equipped to deal with the emotional and the spiritual aspect of going through this such a process. And so the more that you tell your story, as a physician, it's important that we listen, just as much as it's important that your family, folks in our community listen, because it really does make a difference. I tell people that after an operation, the operation will be a success, but as you continue to recover for at least a year after a big surgery. So you may feel well at a month, you may feel better at 2 months. It takes some patience and determination, but you'll feel better a year later and look back on the month after surgery as you were still recovering. So it really is quite a journey to recover from a surgery of that size. And it's not something where you can flip a switch and say, I'm fully recovered. And that journey has ups and downs. There may be setbacks, there may be concerns, there may be doubt, but it's as a doctor, we want to encourage people to continue that journey of recovery.
And I would say faith has a lot for me, my faith has a lot to do with it, and relying on my faith community and my community within my sorority sisters, within my friends, within my family. That was a huge help within my recovery. And especially, like I said, I was able to talk through faith questions with my priest, and he was in awe of all of it as well. And he's just like, he would say, Lo, I don't know, you have a purpose here. And I'm like, okay, well, what is it? Well, I can't tell you that. You need to pray on it. I'm like, okay. So just having that sense of faith in that faith community and that community to help you through. I was blessed that my parents could take time off of their work and be up here with me for 3 months to help me through the recovery, because I have no family here. And I have good friends, but I had no family, and my parents were able to be here through the rehab, through the surgery, and help me out. So, I mean, those were like blessings in disguises that, helped me through this whole process.
I have a couple of questions. I hope they're not too personal, but I'm asking from a layman's point of view. How much pain was there? How much pain was there leading up to the surgery, and how much pain did you experience after the surgery? I just cannot imagine having my rib cage broken and opened up. That's what I think happens in this surgery. I could be wrong. That's number one. Second question is this: what do you know now? What can you say that I know now that I didn't know before? Are there three things that you can say because of this experience? This I know.
Pain level, I am a pain wimp. I do not like pain. My mother is the master of making sure you don't feel it. So she had it written down on a time slot in regards to pain medicine. So I honestly, I never felt the pain.
So you managed it properly. You had
Yeah, managed
successful
it.
management. Okay.
Yeah, managed it very well. Um, the things that I didn't know that I know now, one is, like I said, I didn't realize just doing this impacts everything. And that was a big eye opener for me. And then also having that type of major surgery, there's going to be a major recovery afterwards. Because the only other surgery that I had ever had before that was ACL reconstruction. And I was up and they had me trying to walk within X amount of hours of that. And so, being in a hospital, being in a bed, with catheters and everything else, it was, you know, I like to be moving. And so that was kind of an eye opener for me. And the other piece was just learning, doing the research and talking to the physicians and learning all about the heart. I had never heard of it. TEE, transesophageal echocardiogram. Didn't know that they could put a scope down your throat and see your heart. Had no idea that. I'm like, well, don't you have to move things out the way to see it? No, we can do this. So it's learning all about the heart and the medical pieces of the heart was one of the things that I've taken away from this experience.
I think your questions about the pain and the procedure itself are so important because while this particular surgery that you had with the aorta is not super common, having some type of chest cracking procedure is a little bit more common. And I think sometimes people don't get some of the indicated procedures that they need simply out of fear of the pain and the aftermath. And
Mhm.
so I think that your question, Al, and your comments, I hope are really appreciated for people to know. Here you are, you're very intelligent and put together, and you did it all. And like you said, the pain was controlled. And I think that is our experience overall. But of course, it is scary to think about having your chest cracked open, as we sort of say, and maneuvered so that we can get to the heart. But that's often what we have to do for valve surgery or bypass surgery, depending on um, the indicated procedure. But, and as you also mentioned, learning so much more about, you're doing a great job with all the terms that we use in medicine. And, but again, I think the more information that we have that these procedures are safe to do and that you came out just great on the other end, I think that really helps people. Related to that, my question for you is about trust. We often have conversations about the lack of trust between particularly African Americans and the healthcare community. How has that been for you through your journey? What was it like as you were getting diagnosed, in the treatment, and now, and any advice that you would give?
So at first, I could say the trust wasn't there. I mean, that whole year, 2005, that I went misdiagnosed and, trying when I did find a primary care physician, I mean, I changed my primary care physician several times, and then finding the one that actually wouldn't blow me off, that listened to me. that was an eye opener. And that built trust there, and to the point that I was able, when she said, just humor me this last time, I was like, okay, fine. And that took a lot of trust for me to go through that last test. Um, the other piece is just having, I had a good cardiologist and a good surgeon. And the surgeon was just like, get a second opinion. I want you to get a second opinion. You should get a second opinion. And I was like, I never, when I was talking to him, I never thought about that. But he's like, no, here, I will give you a copy of the test that we did. You take this videotape, take it to somebody else, have them review it, get a second opinion. I would encourage you to do that. And I was like, okay, fine. And I did get a second opinion. And then even with that, the second opinion, I asked two to three other, actually three other cardiologists, okay, this is the cardiac surgeon. What do you know about him? And they were like, oh, he's in his prime. He was good. I'm like, my mom was like, what do you mean in his prime? They're like, well, he's kind of up there in age. And sure enough, not long after my surgery, he retired. But they're like, he's one of the best in the country that has done this type of surgery. And we're like, okay. And that eased my fears a little bit. It eased my mom's fears a little bit, for a simple fact. I was up here and there was no way I was going to be able to get down to Central Illinois to somebody that they knew. And so it just going to get that second opinion was key, but also ask around, ask questions about your physicians if you're not, and then making that connection. So now I know I have, one of the things that I've done differently since then is I always have those personal connections. And I didn't realize until my primary care physician that I had at the time left and went to a different practice. She went into bariatrics. And then, so I had to find another primary care physician. And I asked her for recommendations. And she recommended people. And she said, schedule an appointment, not a physical, schedule an appointment to talk to them, to see if you guys gel and mesh, because you're not going to gel and mesh with everybody. And I was just like, you can do that? And she's like, oh yeah, you can do that. And so from that point on, anytime I had to change primary care physicians, I always set up an appointment and I sit down and talk to the person. And, it's just like, she's like, you can interview them. I'm like, really? She's like, yeah, interview them. See who's going to work with you, who's going to be best for you. She's like, there's nothing worse than having a physician that you go to that you don't particularly care for. You guys don't mesh. That's not going to be beneficial for your health.
That's fascinating information for me. I think the idea that we can and should educate ourselves and our families to adopt the attitude that it's okay to interview people that would serve us in health and other professions as well. And that's great information, because I hadn't thought of it that way, but that's clearly what you're saying, what you've been told, what you're doing now. That simply does reflect being in the driver's seat in managing your health and wellness in your future. I want to ask the doctors the same question I kind of ask you, Loralean and Docs. So what do you know now that maybe you didn't know when you started your practice, either about the medicine, the health that you're practicing, or about your customers, your patients? Is there something that you know now that you continue to evolve awareness and capability through the gaining of knowledge?
Mosi, you want to go first?
That's a good question, a tough one to answer, but I guess the easy answer is there's so much, but I think the focus here is that there is really a lot of times it doesn't matter all the facts and details and science. It becomes almost secondary to the demonstrating that you care and can build a relationship with your patients. I tell my patients that it's my job to worry about you, and one thing I've appreciated over the years, if something doesn't add up, if something doesn't make sense, if there's a nagging question that neither patient, person, or I can't answer, then we need to look a little bit harder. And that's not, I appreciate that more the more I've been doing this. And it's okay not to have all the answers, but but you should never feel or entirely comfortable not having the answers. So I worry about people that I take care of all the time, all hours of the day. And that's something that I think is important, because I think it helps build the best relationship and hopefully deliver better care.
Yeah, I agree. I would say two things on my end. One is what a partnership it is. I often talk to my patients that I'm sort of a guide, and the years of training and school and experience that I've gone through give me some skills to help give you options, but that ultimately the path forward is usually a partnership of what's going to work for you as an individual, regardless of what the evidence might say, because you're going to live your life how you're going to live your life. So to do that together, I think is really important, that we're communicating and have an understanding. And then lastly, you mentioned this, Loralean, I think the importance of some sort of purpose, something bigger, whether that's your religion, your spirit, your family, whatever that is so critical to how we thrive as human beings. And so again, I think that ends up being a critical part of the conversation of what gets you through this journey and helps you continue. And it's part of what I love about medicine, is getting to find that unique part out about each individual, because it's so different for everyone. So we're lucky to do what we do, I think.
Well, listen, we've come to the end of our hour. This has been a wonderful, wonderful conversation. Courtney, thank you for the idea, and special thanks to Batala McFarland, the organizer and initiator, moving our company forward in this partnership, representing our new project. We call it iHeal, and iHeal is the acronym for Insight Health Equity Action Lab. And among other things, that project exists to do exactly what we're doing now. Talk to our people, to the community, to each other, and to the world about things that we experience, things that we know, bringing the value of our experience, our lived experiences, and our desire for healthy, sustainable lives and livelihoods. So thanks to all of you. Thanks for the Minneapolis Heart Institute and the Heart Institute Foundation. Thank you, Dr. Mosi Bennett. Thank you, Dr. Courtney Jordan-Baechler. Thank you so much, Loralean Jordan. Powerful story, great testimony. Continue. I'm Al McFarland. We'll see you next time.
Thanks.